Australia's COVID response will be the subject of an inquiry, but not one that's led by government. Instead, philanthropic groups have teamed together to have an inquiry, including funding from mining magnate Andrew Forrest. It will be led by Peter Shergold, a former top public servant in the Department of Prime Minister and Cabinet. It will report back in September, so whichever side is in power then, we'll get some feedback on what went well and what didn't. Professor Bennett is the Chair of Epidemiology at Deakin University, and she joins me now. Thanks very much for your time. It's a bit different. We did hear both sides saying, well, this is the biggest both health and economic shock of our times. There'll be an inquiry, but they haven't spoken about it as much. Is that why this review is seemingly filling in that gap?
Oh, I think so. We've got through a wave, we've then been hit by another wave, and so we've been caught in that cycle of response. And I think that time for reflection is now. We don't want to have this too far in our rear vision mirror without looking back and saying, well, what have we learnt from this? And I think that's the point here. It's not about saying what was right or even what was wrong in that way. It's saying, what do we take from that? What do we learn? And where do we still have gaps? And I think we've identified gaps in our prior planning for pandemics going through this pandemic. And it's important that we pay attention to those and find ways to address them going ahead so that we're not left vulnerable. We're instead focusing on being a more resilient population that might help prevent future pandemics, let alone know how to respond to them in a much more organised way, I think, a much more coordinated way.
Are there a couple of obvious areas that what was done, even with the best of intentions, it's pretty clear they didn't have the desired impact?
Yeah, look, I think we became very clear that one of the most fundamental areas our public health departments weren't actually resourced to be ready for something like this. And so a lot of the challenge for our public health teams was trying to kind of rebuild or build the aeroplane while we were flying it in an absolute crisis. So there was that. I think we've learned some of that. There has been a lot of investment, obviously, in health departments, but there's still a lot that we could do, actually making those systems run as well as they could with all the infrastructure, which includes how well health departments talk to each other. That ICT infrastructure is really important as well. So I think there's a lot that's still yet to be really fully understood about what in the future we need in our health departments and how we can resource that. But there are other areas too. It's even knowing how to consult, how to build on the great work now done with the community leaders in a lot of our states where we did have outbreaks, but we haven't always seen outbreak response translate to early work around prevention between waves, so that when the next wave came along, for Delta, for example, we found that it was our lower SES suburbs, the suburbs where we always saw higher case numbers because we had a lot of casual workers and so on. They also started the Delta outbreak with lower vaccination rates than neighbouring areas. And so, again, great work to build up those vaccination rates really quickly. That helped build our response to Delta. But, it's now pulling that out and putting that right on the front page. So that's how we think. We focus on prevention as much as, that we learn from response.
So, obviously, you're a medical expert and you spoke about wanting preparedness of health departments and so on to be ready. Is it also about balancing the primacy of health advice and how that actually interacts? Because we heard from a lot of premiers, we're taking the health advice and that's where it would seemingly begin or end. How you balance that out with the economy, education, sort of stress and anxiety for young people, and even, dare I say it, freedom. We value freedom in Australia, right? It's not a dirty word.
Oh, absolutely. And I think that is one of the tasks for this group, to look at that big picture. They're not looking for detail. They're asking for short, sharp, 1,500 word submissions to try and get that helicopter view to see how this worked. We were very focused for a long time on COVID numbers being the outcome that was driving everything. Mm-hmm. But, we don't even understand what proportion of infections were actually detected in that. So there's lots of work that can be done to understand, the approach we used and how else you might do it, so that you are looking at the bigger picture all the time. And yes, you sometimes have to put health first, certainly at the start of the pandemic. Yeah. But we're now 2 years in. And so it's saying, when do you shift? How do you have the capacity to do that bigger system modelling to understand the impacts of interventions, not just on one health measure outcome, but on the economy, on
Right.
other aspects of health.
And I guess to some extent as well, you can talk about setting the rules and what will have the biggest impact and what should we get people to do or not do and limitations. But governments need to set rules that people will actually follow and keep them on side, right? We had a lot of agreement and a lot of people obeying rules in Australia. It doesn't mean they always will. And I just think of things like locking up play equipment and governments being careful to bring people along with them on, on measures that help overall.
Yeah, there's a lot of good work being done now by various groups around the country, looking at how people did experience the pandemic and also their adherence to some of those guidance and rules that were laid out over the time. And so I think there's a lot to learn from that. As you say, also you can't expect some things that might work for a couple of weeks to then work for 2 years, and you have to look at the long view, particularly if you're in a pandemic where you know you'll likely have waves as well. So yeah, a lot to learn. They won't find all of that information, but they'll find where we have gaps, and I'm hoping that's what will come from the inquiry. They'll be directing where we should invest further research, further input, detailed, look into data and so on, so that we can answer some questions. We've got the data there for a lot of this, and we've got community who will participate. So I think,
Yeah.
it's going to be important to unpack this and learn from it.